Hello everyone, you're welcome again to Bone Marriage Show. My name is Bumi Oyagbele. By God's grace, I'm a minister of God, a relationship coach, and a marriage counselor. You're welcome to Bone Marriage Show. With me today in the studio is a woman of God, a mother and a wife. She is Mrs. Foluke Ayebogun. You're welcome, ma'am.
Thank you, ma'am.
I welcome you to Bone Marriage Show. Thanks for honoring our invitation.
Thank you.
God bless you. I would love you to do a short introduction about yourself.
By the grace of God, I'm Mrs. Foluke Ayebogun. I work with being a Teaching Hospital. I'm health practitioner. That is what I do for a living.
Thank you so much. Thank you so much. Thank you. And thank you for all you do for the King's Daughters Marriage Ministry. Whenever we call upon you. So the topic today is family planning. What is family planning?
I want to start family planning in a layman language. Family planning simply means spacing your children.
Okay.
Spacing your children for a number of children that you really need.
Okay.
You might need 2, 3, and how you space them, it matters. That is when we call it family planning.
So you plan the number
So
of
that
years.
both the mother and the child, they are okay. And the child that you are going to, that you have before having another pregnancy is also okay. And the mother have regained all the blood loose during the child delivery.
Okay. So that means family planning is trying to note what exactly that a woman needs, so that we can be able to space it to avoid stress, to avoid health risk or other things. Okay. Thank you so much, ma'am. So when can we do family planning? For a woman who has just gotten married, or for one that has just one child? Because I see a lot of women who are having fear, let me say fear of unknown or fear of whatever. So a lot of women are using another means, saying family planning is difficult, family planning is this. When can they do it and how can they do it?
Thank you. Family planning can be done by the help of contraceptions.
Okay.
You cannot just say you want to do family planning with maybe your own, the way you want it.
Okay.
You can only do it with the help of contraceptions, and it depends on the type of contraception that you choose.
Okay.
And when to do family planning is immediately after your childbirth.
Okay,
After
immediately.
yes, not more than 7 days or 14 weeks.
Wow. Is that not a serious stress on a woman
It's
who just
not.
gave birth?
It's not, because you don't want our husband to go outside.
Okay.
So it's very advisable after 7 or 14 days.
But will a man want to have sexual intercourse with a
Of
woman
course,
who
yes,
just gave birth
even
2
in
weeks?
pregnancy.
I know about pregnancy, but
So,
at least a woman who just gave birth, would the man want to have sex immediately after like 2 weeks?
of course,
Men.
yes, of course. We have so many of them that we still want to see their wife after
Childbirth.
Yeah.
Okay.
So to avoid men going outside.
Okay, so a woman can get pregnant like 2 weeks after
Yes,
pregnancy.
2 weeks after child delivery. If you have intercourse, you can get pregnant.
Wow. So if a woman should get pregnant like that after 2 weeks of pregnancy, what should we do?
We cannot blame God.
We cannot blame God.
We cannot blame God. If a woman should have pregnancy, one thing about child spacing or child family planning or child planning is that both father and mother must have agreed.
Okay.
There should be agreements for both the mother and the husband, the wife and the husband rather. The wife and the husband must have agreements. We want to have 3 children.
This is how you should
How
do it.
some even take family planning because they are not ready to give birth.
Okay.
I'm not ready to to have baby now,
Okay.
you go for family planning.
Okay.
Because you will not like the situation that your husband, while you are outside or maybe you are studying,
Okay.
you don't want your husband to go to another woman. At least to avoid any immorality. To avoid any immorality,
understand.
you just have
Okay. Okay.
to do it. At least to give you time to study, but to give you time to do other things. And when you have agreed, okay, let's start childbearing. It's a blessing after wedding to have a child. It's not something that you must do or die. It's agreement and it's a blessing.
Okay.
So when you have it and say, okay, I want to go for a course, 2 years or 3 years is an agreement.
Okay.
Then you can plan it.
All right, I understand.
You can plan that
Thank you
situation.
so much. So, family planning should be done between a husband with the agreement of the husband and the
both of
wife
them.
to know the time or the number of years. Okay, and to understand that the health risk, the health factors, the health involvement of the woman is important. So you should consider your wife, the health challenge that she's going to go through while having another baby, get pregnant or something like that. Okay, I understand that. So I see a lot of women are afraid of the family planning. Some will say their husband is complaining, their husband actually told them not to do family planning. So what can a woman do if the husband tells you not to do family planning because he's afraid you can blow up, you can be bleeding because of a lot of side effects that some family planning methods have brought up or some women have complained about? What can a woman do when she's afraid of any type of family planning? Because of some told her that she can be bleeding. So what can they do? How many types of family planning do we have? How will a woman know which one that is suitable for her?
Thank you. I think the first question, we have not really answered it properly.
Okay.
Because you said who is to be blamed.
Okay, yes.
We should not blame any of the party. We should not blame any of the party, either the health practitioners, either the mother, the husband, or the wife. You should not blame them, and you cannot blame God. But at times, when it fails like that, it's not all the family planning that fails.
It's not all of them.
It's not all the family planning that we have. Family planning is very safe, but we have at least like 99% of some that 1% of it very thin chance
Percentage
of having
of those that have
having
family
a child.
planning.
Yes, that
Okay.
this can fail, and it's not anything but the only one I can use as sample is IUCD.
But I've seen a woman, despite having IUCD, she did the IUCD, a professional, I think a guy did the family planning for her, the IUCD, and after some months after she did it, she actually got pregnant while the IUCD is still on her.
IUCD needs some technical know-how.
Okay.
Some technical know-how in inserting it.
Wow. Okay.
The first thing lies in the hand of the health practitioners doing the procedure.
Okay.
You should not go to the quackery. Let's learn that if you are doing family planning, don't go to quack. Make sure you go to a very good hospital where you have a very good people that can do it for you. Professionals that can do it for you. Family planning have to do with professionals. You can't just give it to a quackery.
I understand, ma'am.
So
Actually,
in the case of IUCD, when you have IUCD, we used to tell them that there should not be fingering.
okay.
Immediately you do IUCD. Fingering, number one, can cause infection.
Okay.
And IUCD, you don't want infection around it at all. If you don't want it to fail, there should not be any infection around it. It needs a very proper hygiene.
Clean environment. Okay, because there was a time I was at the hospital and I was told that even if you do IUCD, there shouldn't be too much banging, there shouldn't be fingering, there shouldn't be. So it makes a lot of men to be afraid of that and will not encourage their wife to. Because I have a man, as at that yesterday, was telling his wife not to go for IUCD. The wife has this the implant one. The wife has done the implant one and she seems to be menstruating more than once in a month.
Implants, call it no plants, is very good. Injectables are very good. Tablets are very, very good. The only problem we have with this IUCD is very good also, but the way we handle it.
Okay.
You know, I've said this repeatedly, just the way you handle it. If there's any case that the copper T shifted from uterus, there's a very good opportunity that the sperm can penetrate through.
So I will, if
to
a
the
woman,
uterus.
okay, you said we have the drugs type.
We have tablets, we have injectables,
Okay.
we have the non plants, we have vasectomy also for a permanent.
For a man.
Yes.
Okay, well, I think we would love
We
to talk
need,
about
because
the
of
vasectomy.
this situation on ground now, I think we should recommend vasectomy for our men.
Yes, I think we should do it. Let our men also go for family planning and let's hear the report from them.
I think I recommend that to them. Men should go for vasectomy. They should know what we women are passing through. After all this, maybe it fails, and you are not blaming it on women. They are not to blame.
Yes, I have a man. A case came to my table, a man that actually blamed his wife for the failure of the family plan, despite the woman has ICD on her, and yet she got pregnant after some months, and the husband blamed it on her. So she had to carry the burden of the baby and the pregnancy. So what I want to ask is that, is there a way, a best way that we can, settle this thing so that most times women will not be blamed every time there is maybe a mistake or an unplanned pregnancy due to the failure of the family planning? Because a woman told her husband to follow her to the hospital so that he can go for the best family planning. The husband rejected, told her, if you can't go by yourself, I'm not going to follow you. Because the husband felt it's embarrassing for a man to follow his wife to the hospital. So in the hospital, if you see a man coming with his wife, what importance or what is the value of his coming to the family planning you're going to be?
Where I work, I think we encourage men to come along with their wife. If you are having family planning, you should both agree on it. It's not a one person thing. Like, this is what I want to do it on my own. No, you should agree, yourself and your husband. If possible, come together to the hospital so that you can work it together.
Then you can be able to hear the lecture
The
together.
do's and the don'ts. And it will not be like it's only the woman.
Even the man that was saying that if his wife should be IUCD to be affecting him if he wants to penetrate, because he felt the stream, that rope there will be affecting his penis. So it will even help him to understand some fears are just some fears are just
they were not, yes,
and they are not true.
They were not true. Like in the case of IUCD, you cannot do this, you cannot do that. You can have the normal sexual intercourse with your wife. You can have it in a different style.
Just that there's no going to be fingering.
No fingering. Because it may affect the property.
Okay.
From shifting. If it shifts from the uterus, that might be there will be a problem there. So it has to be fixed to the uterus.
Okay, so
the two wing fixed to the fallopian tubes.
How will a woman know if the IUCD is already the property, right?
Yes.
If it's shifted, it can maybe cause another problem. How will a woman know?
That is why we used to tell them to always feel it. You need to feel it. Not that you be dragging it. Not that you be pulling it.
Okay, what will you feel? Is it the
gargle
or the property?
You have to feel the
rope
every time. At times, we used to tell women that you have to come for checkup.
If you
After
need to come
having
for
this
checkup.
you know that you just sit down and think that I'm safe now, I can do anything. You can do everything, but you still have to come for medical checkup. You still have to come so that we know if this thing is still intact, if it's still at where it's supposed to be.
So let's talk about the IUCD now. If the IUCD is still intact, does that mean that the rope will
it
feel
will
the
still,
rope?
yes.
What if it is no more intact? You will not feel the rope.
If it's no more intact, you might not know. You might not know. But you have to go for, you have to see your you have to go to the hospital where you took the family
What
planning.
sign will that IUCD give you for you to know it has been displaced?
Maybe if the rope did not go back to the normal place,
Okay.
like maybe the rope has to go in a bit,
Okay.
but when you cannot see the rope again, or it has squeezed somewhere, it can fold. It's a thin copper. It feels like a rubber.
Yes.
So this rubber that we are using to plate it can fold and hide at the wall of the uterus.
Okay.
So it's very good to go to check it every
Alright.
time. You need to check it.
Thank
know
you.
that it's
Thank you
intact.
so much, ma'am. I understand.
Yeah.
So about the implant, another one. Like I have someone that did this implant, and she has been complaining of repeated, multiple menstrual cycles.
Flowing.
Yes, in a month. For she can menstruate last week, again it starts again. Such that has an implant on, what can she do?
This we used to tell our people because family planning, the body differs.
Okay.
If I have done IUCD, it's okay for me. When you are going for your own family planning, you must not ask me, Mama, this thing, please, what is the name of that your family planning that you are using? When I get to the hospital, that is what they must use for me. No, our body system differs.
Okay.
So if I get there, they might decide to, maybe after having I don't have a high blood pressure,
Okay.
I don't have a CS
Okay.
in the recent time. So many things
So
that
they
questions that
consider a lot
yes.
of things.
Then after listening to that, they will now choose for you.
Okay.
This is the one that you can use. Like someone that has CS, not more than a week or 2 weeks, you cannot go for IUCD.
Okay.
If you have high blood pressure, you cannot go for it.
Okay.
It has to come down
Very
before you can go for it. If you still want to have babies, you cannot go for injection like Depo-Provera.
Okay.
Preferably non-steroids. That is 2 months. You have to take that to 2 months, every 2 months. But Depo-Provera is 3 months.
Wow. This stress on a woman.
You have to take it. You just have to do it. That is why I say we must be in agreement with our husband. They must feel what you are feeling. They must know what you are passing through.
But a lot of men, they don't even want to know. They don't even want to care. Or when you even explain to them, they don't understand. They felt my mother gave birth and I didn't even know about this stress. So I think we need to encourage the men to please try to understand and try your best to show care and concern to your wife. A lot of stress, the health risk that a woman is going through, carrying pregnancy, taking care of the children, carrying another baby. It's not an easy task. Please celebrate your wife, encourage her, and make life to be easy for her in whatever capacity or ability. And God bless you. In Jesus' name. Amen. So, Ma, I want to ask about this. So, if a woman is bleeding and her husband is discouraging her from going for another family planning method, what can she do? Because the husband is afraid of IUCD because of the rubber, that property. The husband is afraid the thing will be affecting his own
Penetration.
Yes. What can a woman, when she's having repeated multiple menses?
The woman just have to save herself alive. She just have to, if the husband is not, like what I said before, they have to be in agreement. But if the husband has refused to be in agreement with
To
the wife,
understand.
maybe you should involve another one of the families.
Yes.
Let them know about it.
So that you
I
can
mean, having
orient
every
the husband.
bleeding. Please, this man should allow me. I need to save my life. If the bleeding should be persistent, it might cause any.
Yeah, because she even complained that even if she wants to maybe enter a car or ride on a motorcycle, that she always feels so faintly, and
Yes.
it's always very heavy for her because of that. She has to be going around with cars every time.
So she just have to save herself.
So as a woman, you may need to make a decision concerning your life. Even if your husband is not understanding you, you may need to take another great step in calling for him and saving your own life. So I think
You can use them, you can go for any better ones. We have a lot of them. If IUCD is not working for you, go for another one. And very easy to do. If you want to plant, you not plant. It's also safe.
Wow, 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 wow. Because the stress on a woman is really, really much considering the pregnancy, giving birth, some will give birth to 2 years, and at the end of the family plan, no problem, no problem. We trust God to help every woman out there. And so I wanted to encourage the husbands, encourage our men. What are the things they are supposed to encourage to assist their wives? Because this stress of the family planning, some will have gone for one before when they see that it's not conducive for them, it's not okay, they will change it. This changing a family plan itself or the failure, it has a psychological effect on the women. So please encourage the men. What are their responsibilities? Please, men, do follow our wife to the hospital to have the family planning on. Make sure you follow them so that you not be is my wife that is this and not me. That is my number one advice. Follow them and please let let's free for men. It is high time we need to free for us that we are passing through a lot. Men pass through a lot but it differs. Yes. Carrying pregnancy for 9 months, giving birth, nothing that baby. And after some time, you hear, let's go for family planning. And women repeat one point. I think we should advise the men to also go for vasectomy. Yes, it's not that. Can we launch that? Can we pass the bill? We are going to tell the health providers to please maybe when they come, don't tell the husband, let's go for vasectomy. I know they will not want to agree. No problem. So, well, that's all we have for you on family planning on this topic on home marriage. I want to encourage you out there, if you're a woman, please, your health comes first. Even if your husband is discouraging you, that you should not change the family planning that is affecting your health, please, constantly, women, let's visit our health practitioner. Let's make our complaints. Don't just die in silence or don't just assume it's gonna pass, it's gonna pass. And men, like we have said, please encourage your wife, support her, show her some love and some care. A lot of issues that women are passing through some, giving birth, nursing the baby, family planning, a lot health issues. There are many to support your wife. And I want to believe that you have learned one or two things today on the Home Marriage Show. I would love you to help us share. If you have a question, please send it to me through my WhatsApp or through Facebook or through Messenger. I'm going to reply or answer your question. So I want to celebrate again my guest on the show. Thank you, Mrs. Funke Ayebobo. I want to see another time when I call you, you want to come again to honor us with your invitation. So, we must settle. My name is Miriam Lee.